Hi, Dr. Sean. How you doing?
Yeah, very well, thank you.
Yeah, hello, everyone out there. Dr. Mark here from Adjusted Chiropractic with Dr. Sean. Thank you very much for your time. We're talking about a couple of things today. I actually want to get your advice on a couple of things today. A patient of mine asked me a couple of questions. One of the questions he asked me is actually a very high-level basketball player. He's a young man playing basketball, playing a lot of basketball, and he was asking me about creatine. And how to take it, when to take it. He's already taken. He just wanted to know whether he was doing the right thing, what it does, etc. Now, I have a little bit of information myself on it, but I know you've got all the information because you love this stuff. You do all the research, you look at all the science on it. So what I thought is to get you on today to get your experience for everyone to understand how it works and what they should be understanding in this section. So do you want to just throw right into it?
Yeah, all right. So creatine has typically been used in bodybuilding. So people who do a lot of weight training and want to get maximize their training and get the most out of it, take creatine. Been studied for like 100 years. It's shown to be one of the safest things you can take. Typically, you get it in meats in your diet, but what it is, it's actually stored in your muscle. And it is the thing that replenishes your energy stores. So when you're lifting a weight, you've got a certain amount of energy that is used, and then that energy needs to be built back up. And the creatine is actually the nutrient that we reattach in to create more energy. So basically, if you can do 10 reps of a certain weight on a lift, on a bench press, let's say. If your creatine is maxed out, you may be able to do 11 or 12 reps. So it just means that you're able to get a little bit more out of your training. And again, it's going to give you a bit more energy during performance, so during sport and athletic activities.
So for someone like this young man playing basketball, training a lot, creatine is a good idea.
Yeah, absolutely.
Yeah.
And there is a bit of research that I've seen regarding it helping with some endurance activities as well.
Mm-hmm.
So I've seen people who are like long distance swimmers were taking creatine. And then, the latest thing that it's also being used for is for brain health as well, because there is about 5% of it is stored in the brain, and it is involved in energy creation in the brain as well. So,
gee, that's interesting. I didn't know that. That's extraordinary. Yeah. So how much should be taken and when should it be taken?
Yeah. So just 5 grams a day, which is just a teaspoon.
Like a teaspoon.
Every day, ongoing, and you can have that anytime. Doesn't matter. A lot of people will have it pre-workout, or they'll say that you should have it before a workout, but it actually doesn't matter. You can have it anytime, and the stores will just be full for ready to go whenever you train. So even if you have it in the evening and then you don't train until the next day, the creatine is just there waiting to be used. It actually doesn't matter what time of day you have it, empty stomach or with food, doesn't matter. Just get 5 grams in every day. Some people in the past have said if you're going to use it for the first time, you can do 20 grams over the first couple of days to week, just to kind of bump those stores up. But really, just 5 grams a day ongoing is the best way.
And it's pretty cost effective. It's pretty cheap.
Yeah, it's one of the cheapest things. I think you buy a bag for like $30 and it'll last you like 12 months.
Yeah, you're only having a teaspoon of it. Have you got a bag there that we can show everybody?
This is
the
one. And so the one thing I will say, when you are looking to purchase creatine, the ingredient should just be creatine monohydrate. There should be nothing else in there.
Okay. So some formulas add other things that really shouldn't be there. We've got to be wary of that.
Yeah, anything else that's added to it is just a waste.
Okay, that's a good point. All right, that's awesome. That's great information. I think now another thing I wanted to quickly speak to you about today is a case study too. Can I just ask you a couple of questions as well? Now, this is a case study that came across with regards to balance and coordination. Now, this is an elderly patient. This is a case study done on an elderly patient. But when I was speaking to this basketballer, he was talking to me. Now, I've also worked with him because he has in the past twisted an ankle. So we're working on balance as well. And just really in sport, the better your balance is, the better a sports person you are. So I just want to ask you a couple of questions here and bring this to attention as well, because I'm doing some work with him on the balance board, different things like that, just to improve balance. Now, one of the things is we go through some balance tests when we do neurological tests in cases where we see that there might be some deficiencies there, and we can actually give exercises or correctives to improve that. Now, this is a case study on a 65-year-old male who came in to a chiropractic office because he was having balance problems. Through the adjustments, etc., those balance problems were taken away. He had better balance, and he could also do on physical examination things that couldn't be done on the original tests. And also he experienced increased sensation in his feet bilaterally, which means the nervous system was working better, the brain's working better. My question is, we talk a lot about balance in the way of elderly, that's something to keep in check, but in concussions as well in the young. Now, this is something we, and you train with regards to football teams, etc., and you help them and you see many concussions. What is it that can be done, and what is it that we need to be wary with regards to balance, concussion, and also things that support the brain? Like you mentioned, creatine, that's one thing. How can we support it? How can we test it? What needs to be done?
Yeah, so a lot of the research recently in creatine, as you said, as we mentioned earlier, is into the brain, and it was to do with brain injuries. So people who had concussion, they were giving them creatine and seeing how they responded and how well they improved. And they found that by supplementing with creatine would actually improve the functioning of the brain, and their recovery time would improve as well, so get them back performing as normal. One of the things that we do is we want to look and see how the person is coordinating movement. So we're looking at the balance between the left side and the right side, looking at upper limb and lower limb and seeing how they're coordinating, and also checking pupils and seeing how the eyes are responding after a brain injury. And then we can use that to see how they're recovering. So immediately after having a brain injury, a concussion, you can see that they'll have issues with dilating and restricting the pupils. They'll have balance issues, might be more pronounced on one side, might be more pronounced in the upper limb or the lower limb. So what we want to do is make some corrections to the spine and give some rehab based around where the deficiencies are, and then you can monitor that improvement over the week to month, and really see the balance starting to return and seeing the pupils starting to behave normally, and seeing the coordination returning back to normal.
Yeah, absolutely fantastic. So there are many things to be done. In your experience, I probably know the answer myself, but how long does it take to come back from a concussion? How long does the brain need to recover?
Depends on the severity of the concussion, depends on how many times they've had concussions in the past. So it's people who've had 2 concussions within 2-3 weeks, it can be significantly longer. So some people develop post-concussion syndrome, which is, it can last months, up to 4 to 6 months, where they can have lingering issues. So it's really a case-by-case thing, but yeah, it depends entirely on the severity. And we really use the symptoms and the person, the tests that we do, we use them to monitor when people should really start to return back into normal activities. You don't want to send someone back into a high contact sport if they're still experiencing noticeable effects on those tests, where they're having issues with coordination and the brain's not working in the way it should. If it hasn't fully recovered, the worst thing would be to go out and get another brain injury.
Yeah, absolutely. Getting hit again on a concussion is a very dangerous thing. just to put it in a little bit of perspective, Dr. Sean, I just want to put it probably in layman's terms a little bit. Concussion is when the nervous system, so we get a knock to the head, knock to the brain tissue, and then effectively, a lot of people think it's damage to the brain tissue itself. Look, there is components of that as the brain gets shaken around their head. But part of what's going on also is that the brain shuts down neurological pathways. So it sort of shuts itself down as a protective mechanism. So this is why we get things like balance issues and things like that, which can improve with certain things that get done to reopen those pathways again. Okay, they're going down the spinal cord. Now, if the brain is shut down because it's had a hit and it's trying to protect itself, you can sort of imagine the brain sort of saying, no, I want to protect myself now because I've had some trauma. And then it gets hit again. That's, neurologically, the electrical impulses, that can sometimes be devastating, where it just says, I'm never going to open back up again. I'm never going to, reinstate those pathways because I've just been, there's just been too much trauma. So I think for people out there to understand is that concussion is something that's very serious to be taken care of, but also to be given time to improve and for the neurology of the brain to normalize. And that's what we're looking for. We're looking for normalization. We're looking for balance of how the nervous system is working. Yeah. Any comments you have on that? No,
that was spot on. That's exactly what we're looking at.
Yeah, so it's just about protecting that neurological tissue. So there you go. So thank you very much for your input today. I think that's very helpful, particularly to the person who was asking me those questions about creatine. And then, let's just continue looking after as many sports people as we possibly can. Make sure that any injuries are taken care of as well. Obviously, if anyone has any questions, please do contact myself. Contact Dr. Sean, always available for any sporting questions as well. We're here to help you. I thank you very much for your time, Dr. Sean, today. We'll leave it at that. Bye, everyone. Have a great week, and we'll see you very soon. Bye for now.